Hello, hello. Thank you so much for tuning in. My name is Megan Marini, and I wanted to share with you a hospital readiness program that I've mobilized and have ready to support with the COVID pandemic that we're now facing as a country. This project came to me as a solution. I was like, well, what will I do to help? And I thought that volunteering in a hospital would make a lot of sense right now. And then I thought about all of the folks that I know that are out of work right now and unable to work, such as people that have some clinical background and some medical training, maybe not clinical, medical, such as physical therapists. And then you have all of the restaurant workers, all of the gig economy, all of these able bodies that would likely go and help and work and even get paid to work, right? So this is that idea, and I've since mobilized a small but very robust team. And one of them has a medical staffing agency, and they're in 9 states. They've worked with all the major hospitals. And another gentleman who is a recruiter. So we're able to kind of bring a pipeline of human capital, get them trained. It's a 3-tier training, which I'll explain, and then bring them into the hospital to help expand. You might be asking, why? Don't we need just more doctors and RNs? Well, yes, tier 1 is doctors and nurses. But we also could support those doctors and nurses with a break, a lunch break. Instead of 16 hours, maybe they only have to work 12. Maybe each doctor has 2 assistants that can help them with non-critical tasks, communication between patients or different departments, who can go run simple tasks. I don't know if you've ever worked in a crisis situation before, but having hands around is an extremely important thing to have. And the other piece that you might be asking is, what about all of the rules and regulations? And if you've been tracking this closely, you'll know that the rules and regulations and an unprecedented move by the federal government, and then as well as support at the state level, are really loosening up any types of rules around help and support, which is just needed right now. So yes, so this program has 3 tiers. The first tier are those that already have medical training, that are ready and able to go, and they can be deployed in a hospital in a matter of days. The second tier are those who have some medical training, such as physical therapists, those who are laid off right now, or are just not working, right? Tier 3 are civilians, people like myself who could be trained up in a week and given all of the appropriate shots, taking like a first aid class, defibrillator class, CPR, and then all of the background checks that need to happen. And then there's hospital specific training that we can put them through with this rapid training, and then we can bring in support. And I know that everyone has been primarily focused on equipment, which is so important, and I do not want to diminish that. And I know there's a lot of really great hands, minds, spirits working on that. The other piece is supporting those that are on the front line. Now, we know that there's been a lot of activity in the past 5 weeks to reactivate those who have retired doctors, as well as those that are in sort of parallel fields. They're pulling them over and saying, okay, so you can't operate your med spa any longer. Come on over and field these COVID calls. We know that's been happening. It's amped up even more in the past few days. As well as there's 93,000 med students that were sent home a few weeks ago from school. This is great. We need that. We still could use more people. And anything non-critical could be done by this cross-functional aid position, freeing up the mental bandwidth and allowing that person to have a break. And this is going to be so important, as well as we see 15 to 25% of the front line getting hit with the virus, right? So those that are left are going to be taxed even further. So this program is something that is ready to go. I'm right in Boston. I'm easy to get to. My name is Megan Marini. And we also have the ability to move. We have a moving company. This is a second separate mobilized branch engineering firm that we can move location, and we can also build out med locations. So it's sort of a two-in-one if needed, or you could just do human capital, or you could just do location if you need. But I'm happy to make these connections for you and support. So let me know. And again, it's very easy to find me. I believe meganmarini.com, and my telephone number is 720-771-3663. Thank you so much. And so many blessings to all of you. Thank you for watching.